In the United States, an estimated 500 to 1,000 new cases of primary pulmonary hypertension are diagnosed each year. The greatest numbers reported in women between the ages of 20 and 40. We will explore that here in just a moment. I want to introduce Dr. Jasmine Shah, who's a pulmonologist with the University of Pulmonology and Critical Care, as we talk about pulmonary hypertension. Welcome to our program. What is pulmonary hypertension?
Thank you, Mr. Welch, for having me. Pulmonary hypertension is basically, in simple man's term, high blood pressure in the lungs. We all measure blood pressure in the arms. We know that when we go to doctors. But the same arteries that supply the arms and the rest of the body, similar arteries are present in the lungs coming from the heart, but the right side of the heart. And when the blood pressure is high in those arteries and going into lungs, it's called pulmonary hypertension.
Well, is there a cure or is it just treatment?
It is treatment. There is no specific cure for it. Okay. And pulmonary hypertension is caused by multiple different causes. One is unknown or called idiopathic pulmonary hypertension, and that happens in young women. But it could also be caused because the heart is not working well, or the lungs are not working well because of COPD or pulmonary fibrosis, or sometimes because of sleep apnea, or other reasons like connective tissue disorders, scleroderma, and sometimes because of clots in the lungs. We have all heard of that. So when we have chronic clots in the lungs, it could cause pulmonary hypertension. As you asked, there is no definite cure for it, but we do treat it to keep the numbers low so that the patients can function. And by function, I mean patient feels short of breath when they have pulmonary hypertension in doing little things, walking 10 feet, walking 20 feet, sweeping the floor, washing the dishes.
Goodness.
So that is the reason we need to treat it, but cannot cure it.
All right, now a minute ago I said the greatest numbers between women between ages 20 and 40. Any particular reason? No
particular reason found thus far, but we are still looking, and we might.
Yeah.
So
that is awesome to think that.
It indeed is, and it's very intriguing. And so far, all we have been able to do is maintain a registry of pulmonary hypertension. That's a national registry, and all of us report the numbers to them, and they just keep a track of how people progress. And believe it or not, if your numbers are too high, and if you're more than 50 years of age, there's only 10% chance that you'll make it through the year once you're diagnosed.
Really? And folks, I don't want you to think that I said a moment ago that men don't have this problem, because men and even children as well,
absolutely.
Can't they?
Children have it mainly because they're born with heart defects, or what we call cyanotic congenital heart diseases. And they can get pulmonary hypertension because of that. And once the defect is resolved, a big part of the pulmonary hypertension is resolved. Some of them do keep it for the rest of their life.
Oh, really? Always? Wow. I guess one of these days, maybe we'll hear about
We definitely will. The research is ongoing, and we are not going to stop here.
Yeah, oh, that's good. Thank you for being with us today. By the way, if you'd like more information, you can go to Erlanger's website, or you can call 778-LINK. Now let's join Mr. Food in the kitchen. Time for a fancy potato dish.
We don't have to travel to the French city of Lyon